Today marks 3 years since the first case of COVID-19 was reported in South Africa. On the day, former Health Minister Dr Zweli Mkhize, who announced the National Institute of Communicable Diseases, had confirmed that a suspected case of COVID-19 had tested positive. The patient was a 38-year-old man who travelled to Italy with his wife. They were part of a group of 10 people who had returned to South Africa 4 days prior to the detention. Now, to look back on the day and how South Africa has responded to the pandemic and where we are today in terms of our response, I'm now joined by Health Minister Dr Joe Passa. Dr Passa, very good afternoon to you. Thank you so much for joining us. Welcome to Newzroom Afrika.
Welcome, and thank you very much. Thanks for having me on this very important anniversary. Happy to talk to the nation.
Absolutely, an important anniversary indeed, especially looking at what was happening in the country 3 years ago. A lot of fear, a lot of tension, a lot of uncertainty. We've certainly come a long way.
Well, definitely, I mean, at the time, one of the things which reminds me of just a few weeks before this, confirming what you're saying about uncertainty, you would remember we had students who were trapped in Wuhan City in China, and we are making plans to get them back. And at the time, there was so much concern that some of our leaders, when we identified the place, for instance, in Limpopo, where the students would be cared for, there was a lot of concern that we will be bringing the COVID-19 risk to the province. I think just an example of the anxiety of the people, and now at the end, I mean, we all had to live with it, and we're here today.
Yeah. And just looking at, the road that South Africa has traveled in terms of the availability of the vaccines and the different phases that led to different groups being selected and the top-ups, what do you think have been the very important lessons? I mean, deaths, almost 100,000 people lost their lives during the time. What do you think are some of the very important lessons?
Well, the important lessons is that, there is still huge inequity and inequality of access to life-saving devices, life-saving medication, and including the vaccines. And even, I mean, when this started, even just ability to diagnose, because we were a bit lucky in the sense that our laboratories, both in the public and private sector, already had some expertise, especially, some of the machines advanced machines which we use, for instance, for diagnosing other viruses like Ebola and also diagnosing tuberculosis, the gene expert machines. All this came to good use, but the capacity was fairly limited. So the inequality in the world is a major constraint, and that's why, as a country, I mean, even the mere fact that we had to start when the vaccines became available, to say we'll start with the most at risk, which is the health workers, and then we moved, as you remember, to educators, and then started with the older age, above 60 and all. But if we had access to these life-saving vaccines, we could have, from the start, rolled out to at least all adults. And the limited coverage, I mean, we're happy that at least where we are currently, we were able to be able to vaccinate more than 70% of the over 60 and just under 52% of adults over 18 years. But if right from the beginning, when the pandemic was at its worst, if we had all these life-saving vaccines, by the time when the anti-vaccine people came and started being very noisy, we would have covered the 70% of the adult population which we had wished for. So that's why we are working very hard, led by our president, campaigning all over the world to make sure that there must be some kind of equalization of access to all these life-saving tools, because we don't think this is the last pandemic.
Yeah. As you speak about the life-saving vaccines, Minister, we know that these have not been spared their share of controversy. As you and I speak, some NPOs have taken you and President Cyril Ramaphosa to court over the supply of COVID-19 vaccines within the age group 5 to 11, citing deficiencies in the Pfizer jab. How are you handling that?
Well, I think it's, well, to start with, the 5 to 11, they are eligible under particular circumstances only at this stage. We have not generally made, a campaign to vaccinate children between 5 and 11, except if they are immunocompromised, then they are eligible. There have been calls, especially in cases where parents want to travel with their children, that the children should also have access to vaccination. So we also do have overall challenges. There are some organizations which are not only challenging 5 to 11, even the 12 to 18-year-olds. There are organizations which are challenging us, but we are opposing those challenges because you remember that in South Africa, we never made it compulsory for vaccination, but we've encouraged people, even the adults, to come forward. That's why, even though there have been circumstances, workplaces where certain employers made it compulsory, but as a country, as a government, we never generally made it compulsory. So, but in terms of those who say we must actually stop even making the vaccines available for certain categories of people who qualify in terms of the regulatory approval of those vaccines. We are opposing that because this is a matter of choice. Those who, parents, in terms of minors, parents who give permission for their children to be vaccinated, those who qualify, we want to give them that opportunity. So we're going to continue to oppose because these are life-saving, devices which have proven to actually, prevent serious illness and even death.
Yeah, you never made it compulsory. I mean, you say these are life-saving mechanisms to prevent death, but the questions really were revolved around the dosage, because the concerns are coming around the dosage and how the mixing is made and whether or not the dosage is correct. Is that an area of concern with you when it comes to the dosage, when it comes to that age group?
No, I have no concern. Remember, we have a very strong regulatory body, the South African Health Product Regulatory Authority, in short called SAPRA, which also doesn't work alone, especially in terms of these medicines and vaccines, which are also used all over the globe. But SAPRA does not simply just accept any medicine, including the vaccines, simply because they are approved in other parts of the world. They have themselves to look at the data. The manufacturers have to supply, and for all age groups, it's not different from any other medicine. They have to submit safety and efficacy in terms of the actual age group. So the dosages are determined on the basis of proof of effectiveness and safety. So, and I've got no doubt that SAPRA has satisfied itself that those are the safe dosages and also effective in terms of preventing serious illness and death, even amongst the minors.